Serious doctors, have you ever wanted to refuse a patient? What did Husha do? Story 1. Yeah, drug seekers who get really mean and nasty and in my face, yelling at me, insulting my intelligence and education, gorked out on who know what legal pills and illegal substances. Those people ruin my day. I add fuel to the fire by refusing to give them any more narcotics. Story 2. Yep, currently discharging a patient for forging disability paperwork and faking my signature on the form. DHS Department of Human Services hilariously contacted my office requesting that I sign it myself rather than having the patient do it for me, as if she had my consent to commit fraud. Story 3. I am a nurse at an allergy and immunology clinic. Since we're not an ER, we have the right to refuse patients. Most people are asked to leave simply because they are being to the staff. People can get really angry and abusive about their bills. In my time, I have seen maybe 5 patients terminated for their inappropriate behavior. More often, the most interesting folks we turn away are not even patients. For a long time, we had a nice homeless man who would come in at least once a week in a tattered fake UPS uniform and ask if we had any packages. We would always tell him we did not, and he would quietly take a fistful of lollipops from the front desk and leave. We eventually had to tip off the building manager as patients were complaining, but I think about him every so often. I truly hope that somewhere, someone is providing him with candy. Story 4. I once fired a patient for being in incredible pain, and the details escape me. Years later, after I had moved to a new location, she showed up to make an appointment, not knowing I was there. New staff read her chart, "Do not ever appoint this person," and froze up with her in waiting room. They came to ask me what to do, but by the time I had gotten out there, she was already being crazy and said very loudly, "I would never come to this place. You are all very rude," and left of her own accord. She basically fired herself a second time. Story 5. I am a psychologist, but not a physician. I refuse to treat people all the time. However, by treatment, I really mean assessment, as this is what I do, along with some counseling in select cases. I refuse to treat adolescent patients that do not agree to therapy. It's a waste of everyone's time. I also refuse to treat or assess if there's even a hint of an upcoming child custody hearing. No, I work in a GP surgery for a while, and I know one of them has transferred at least 3 patients, 2 guys, 1 girl for declaring their love for her. Also, a couple of ridiculously violent people, usually pain pill seekers, get kicked out. Bear in mind this is in a dodgy area of Belfast, and half the patients are former current paramilitary members. So violent means violent. Oh, that reminds me, a different DR in the same surgery had his coat stolen by a patient, and one of the other patients, who was a paramilitary member who really liked him, made sure he got it back with everything in it, minus money that had already been spent, and told him the thief patient would never bother him again. So I guess he had a patient refused on his behalf. Story 6. Yes, people who yell at my staff for no reason at all. People who are clearly drug seekers. We had one guy at the VA who had been seen the previous 3 nights a row for pain. I pulled his chart. I also pulled his chart from 4 previous VAs he has been to. All the same, I denied him. He then sent his wife in for back pain. I took one look and told her to leave. He then moved on to the next VA down the interstate. Edit mobile. Story 7. One night, I rode my bike home from the hospital. This was in a quiet and small town, and so lived very close to the hospital. I see a couple on the side of the street, arguing, then suddenly he starts beating her. She screams and runs into the street to stop a car, but the only car coming along won't stop. So it ends up just being me and that couple. I must have been tired after a long shift, plus the environment is so non-threatening. Small town. Summer, evening with still lots of daylight, and I completely misjudged the situation. I stop and offer the girl to accompany her to the only 5-minute walk to get that cut lip taken care of. She hesitates and acts strangely, and I realize she's high. The same moment, I realize him approaching me. So, I'm tall for a woman, but he's a really tall and strong guy. At this point, he's swearing at me, telling me how sad my parents will be after he will have beaten me to death with his bare hands. Last moment before he reaches me, I jump on my bike and race away as fast as I could. At home, I called the police to go look after the girl. 2 weeks later, I do the night shift, and guess who's brought in swearing and threatening to kill everyone? Stupid druggy guy. Apparently, he took too many sleeping pills and told his girlfriend, who called an ambulance. He then threatened to kill the EMTs, who promptly called the police. Then, of course, he threatened to kill the policeman, and they brought him to the ER, where everyone like that eventually ends up. I had been so scared when the first incident happened, and I had a visceral response when I saw him again. I really did not want to treat him. But this being a small-town hospital, I was the only doctor in the ER in medicine, and I didn't really have a choice, so I had to examine him. I told the police what had happened before, and they stayed at my side the whole time. I vividly remember having to check his pupils, and looking into his hate-filled, junky eyes made me want to run away so bad. I ended up committing him for being a threat to himself and others. Psychiatry released him 2 days later, and he promptly came back to the ER. When I wasn't there, another ER doc committed him again, and psych released him again after 48 hours. It's just how the system worked. Security was at this little hospital, and I ended up refusing to do night shifts without better security. As the hospital was very cheap, they found a med student to shadow me. He was 6 feet something, all muscles, and an avid kickboxer in his free time. Druggy came back once, had an amicable chat with the med student, and as far as I know, never came back. I left the hospital soon afterwards. So yeah, boo, for druggy patient, yay for med student who doubles as kickboxer. Edit with this being read much more than I anticipated. Let me just add something that has bugged me since the incident happened. The girl ran into the street in front, if a car to stop it, face all and beaten, and the car was a guy maybe in his 30s. He stopped, but when she moved to the side of the car, he actually sped up and drove away. While I was being threatened that lasted maybe 3 or 4 minutes, I saw some people behind windows in the nearby houses that simply went away when I pleadingly looked at them. I tried to flat down to maybe 3 or 4 cars that drove by. It was a quiet road, and not one would stop. There was this big, druggy guy obviously threatening me, a scared young woman with a bike in the middle of the road, and a beaten girl with a face on the side of the road. She wasn't badly hurt. At some point, she kept shouting at me and at her boyfriend, and all those cars just drove around us and away. Nobody would stop and help. People sometimes. Story 8 GI doc here. Unfortunately, the patient had borderline personality disorder and would swallow razor blades every time she got into an argument with her boyfriend. She has had more than 30 upper endoscopies. Story 9. I was a nurse at a walk-in clinic when we had a patient come in for a spider bite. She had a small swollen spot on her, but was probably bitten by some common house spider. Definitely not venomous. She wanted a doctor to make it disappear so that she could work that night. She was a stripper and knew that she would make less money with a red swollen bump on her bum. The doctor couldn't do anything, and the patient got angry and started getting loud. She yelled loud enough for the whole clinic to hear, well, just that she wanted the doctor to the venom from her. We immediately asked her to leave. After a few minutes of arguing, we had to call the police. TLDR stripper wanted a spider bite on her sucked. Story 10. Some patients will obviously be difficult to care for, and there are plenty of other doctors in my area. A patient might call and insist on talking with me before making their initial appointment, then not let me off the phone with multiple questions and generally busy, trying to get to the next patient. Worse, they will start to disagree with my over-the-phone answers. This has happened more than once, and I've said to them I'm sorry, but I can tell you would be better off with another physician. At that point, they always back down and talk about how they've heard how wonderful I am, etc. But I let them know they need to call somebody else. The first time this happened, I'd been in practice only a short time and had lots of openings in my schedule, so I was very hesitant to do it, but I was very glad that I did, and realized I had control over my life and my practice. Story 11. All the time. I'm on my break on shift right now, and we've already thrown out 2 tonight. Abusive idiots who don't understand they can't just EFF and blind and get what they want. Every day, we throw patients out here because, at least when I'm in charge, you don't get to walk into my emergency department and shout and be abusive and horrible. When there are poorly patients and kids who don't want to hear that, I don't care if you don't want to wait or if you up your stupid foot being drunk. It could be busted to and back for all I care. If you're shouting and swearing in my face, you can go away. More doctors need this attitude, I feel. Story 12. I am on the other side of this one. When I was in my 20s back in the 80s, I was working for a really shitty factory. I was unloading a truck and pulled a groin muscle, and at first it did not seem too bad, and I just ignored it. One day it really flared up, and I was kind of scared and hurting, so I went to a local clinic, and at admitting I was asked if it was work-related and said yes, and the admitting lady stared at me as if I had 2 heads. I went in to see the doctor and told him what was wrong, and they said, you can't sue your company, you can go back to work tomorrow, and that was it. No explanation of what was wrong or any attempt at help, all delivered with a dismissive and contemptuous voice. At the time, I was young and dumb and pretty used to being treated like at home and at work, so I just left and accepted that as my fate. I have matured a lot since then and don't take that anymore. Story 13. I had a doc discharge refuse me once. I was 16. He was my neurologist for my epilepsy. I had only seen him a couple of times. My parents divorced, were fighting over who would pay for my doctor visits, so I wasn't able to see him as often as I was supposed to. He told me I was irresponsible and I should try harder. Despite being thought of as having to do whatever the doc says, pharmacists have quite a bit of leeway in dispensing. I've had people refuse to leave. Even when closing, people scream and swear and use racist comments, people on the floor of the bathroom, and just plain try to it out of my hand. One went outside, got his car, came through the drive-thru, and asked if this was bulletproof glass. I had no idea, but promptly answered yes. Story 14. This is also the other side of the coin. But as a teen in the 90s, I was particularly entrenched in the whole grunge look. I had terrible problems with ovarian cysts and had ongoing medical treatment for it. At one point, I was sent for an ultrasound, and the tech performing it started berating me, saying your pain is obviously from all of the scar tissue here from your abortion, and kept making comments of the like I was 16 in pain and was horrified by what this man was saying to me. I had never had an abortion. I realized later that he had made assumptions because of how I was dressed, and realized just how shitty people can be sometimes. Story 15. Often, in the ED or hospital, you can't refuse them. Sometimes I give the appropriate care, which is not equal to what they want, i.e. narcotics, benzos, tons of tests. In the clinic, we fire a lot of people. Too many no-shows, fire, cuss out the front desk, and threaten them. Fired. I had a patient come see me today after being with another doc I know well. He wants more OxyContin. The other doc only gives him $30 a month. He is suffering on that. I told him I would take care of him, but I wouldn't be writing for his chronic narcs. He won't be back. Story 16. I had a patient come in, so drunk she couldn't walk, wanting her crowns delivered. We didn't have them. She was rude, so all we did was re-cement her temporary crowns. I had another who's an alcoholic and somehow lost her new denture that I delivered for another doctor. She called me a year later upset that she didn't know what she did with them between the time she left the office and got home. I really wanted to ask her if she called the bar she stopped at to see about the lost and found. I just told her we could make a new one for her if she paid. Story 17. Attention. Please keep in mind that the OP of this thread has chosen to mark this post with a serious replies only tag. Therefore, any replies that are jokes, puns, off-topic, or otherwise non-contributory will be removed. If you see others posting comments that violate this tag, please report them to the mods. Thanks for your cooperation and enjoy the discussion. I am a Botron Torkaminsk 11 Puitus Automoderator, and this action was performed automatically. Please contact the moderators of this subreddit message compose to 2FR, 2F AskReddit if you have any questions or concerns. Story 18. I was a manager at a GP surgery. I've kicked quite a few patients off our list, the majority for abusive, threatening, or racist behavior towards my staff or attempting to defraud the practice. I did, however, refuse to have a patient attend the practice, insisting that he was only ever seen in his own home. He was a convicted pedophile who had also been done for assault on a girl the same age as two of my receptionists. He defecated and urinated in the clothes he stood up in, had probably not bathed since 1973, was permanently drunk, and on the one time he drove to the surgery, hit every wall, barrier, and car in the car park. Luckily, he was recalled to prison not long after he was assigned to us, and was not alive for long after that, having refused treatment for sepsis. Wretched creature. Story 19. I once went to a doctor with my 4X broken arm, which was operated at 3 months before. The tightened nails should be removed soon. Me and my mother waited a normal amount of time, but somehow my mom freaked the out, made a massive scene, causing the doctor to kick me and her out, refusing any future contact. Well done, Mom. Story 20. Nurse here. Known drug addict patient complaining of headache pain. I offered her Tylenol first and explained that if that didn't work, we would offer her something stronger. She started screaming at the top of her lungs that she needed Dilaudid, actually Dilaudid, but that is what she said. That pills did not work for her, and the only thing that helped was Dilaudid. Then she fired me. I was certainly relieved. Story 21. Vet here. So clients rather than patients. I wouldn't say that I fire clients often, but it has certainly happened before and will probably happen again. Usually it's with people who refuse to comply because they read something online, people who routinely waste your time talking about internet diagnoses, both huge time drains, just not worth the trouble, and people who refuse to have their pets properly vaccinated, posing a danger to the rest of the patients. And, of course, people with a history of not paying for treatment. We get drug seekers on occasion, but those are presumably rarer than in human medicine. Story 22. Okay. I can't hold back any longer. I was in a hospital bed. In the process of losing my baby, I had major complications from enlarged fibroids when the queen of nurses accused me about lying about the severity of my pain. Her exact words were, "Nice try, honey." I hope that her life is filled with misery and desperation. Yeah, can't you tell I'm just here for the drugs? Story 23. Sir related. My office phone number is very similar to a pain management clinic's. I had the lovely opportunity to answer the phone of a very pissed off patient who was being refused service and could not understand that she called the wrong number. I could only imagine what the poor workers there experienced with this woman. In the 5 conversations I had with her, I was called a lying she will find where I live her and have her ex-con boyfriend beat the ever-loving out of me, and other various versions of threats of bodily harm and insults. This went on for a week straight before she realized that I wasn't playing a trick on her, that she actually called the wrong number. Story 24. Psychologist. Not being able to afford the $5 copay on the meds you need that keep you from spending $200 or more when the lack of meds puts you in a hospital. But you could buy premium gas for your car, expensive food for your cats, constantly hoard arts and craft stuff at hundreds of dollars a month. Come back and see me when you display the prioritizing necessary to get your life in order. Otherwise, complete waste of time. Story 25. Abuse my staff. You're out. A patient that didn't get what they want, young lady. You work for me. My letter to the patient paraphrased, no, she works for me, and your behavior has compromised the doctor-patient relationship, blah, blah. Story 26. I took my daughter to the pediatricians a while back. We were in the examining room waiting on the doctor's arrival. I received a call from my boss at work and answered because she hadn't arrived. The doctor opened the door, saw me on my phone, and rudely told me she'd return when I decided the appointment was more important than my phone call. If it hadn't been an on-base doctor or major, I think, I would have responded in kind. Instead, I bit my lip. I know I wasn't the doctor, but this one refused me for the time I was on my phone. Work calls. Don't be it to us at the pharmacy, else you get kicked out and your script's elsewhere. We have kicked people out. Mostly drug seekers are the biggest pain but we did 86 a guy who yelled at everyone all the time. Our pharmacy manager tolerates 0. Story 27, just about any chronic pain patient. I know that people really do have chronic pain, and just because you're asking for pain meds doesn't make you a drug seeker or addict. I know this on an intellectual level, but I still hate dealing with them. Hey, race a typical interaction me on a scale of 1 to 10, with 10 being the worst pain you can possibly imagine. Where's your pain? Patient sitting comfortably, chatting amiably 11. Me when I say 1 to 10, I mean that 10 is so intense that you are writhing, screaming in pain you would kill yourself to end the pain. Patient thinks for a moment 11, but I have a high pain tolerance, or this typical discussion patient, I really hate taking pills, but unless I take 120 Percocets a month, I can't function. I would do anything to get off these pills. Meanwhile, there are some alternative things you could do. Give 20-minute discussion about yoga, acupuncture, massage therapy, chiropractors, physical therapy, the anti-inflammatory diet, all of which are backed up by hard data and peer-reviewed studies. 1 month later, me, did you look into any of the things we talked about? Patient, I was kind of busy. Could I get the Percocet? Story 28. My dad is a general surgeon. He can and does regularly refuse to see patients, of course. He doesn't do this if they need immediate life-saving surgery or anything, but he absolutely will for less time-sensitive problems if he doesn't think he's a good fit for them. Story 29. I guess aside from the overtly abusive, violent, straight-up patients, as a neurologist, the most frustrating ones I see on a regular basis are non-compliant seizure patients who also abuse alcohol and street drugs. They come in after being off their meds and going on cocaine and drinking binges, and of course they have seizures. And it's like, okay, I can pump them full of meds now, but ultimately, what do you want me to do for this person? They leave the hospital, stop their meds, start drinking again, and the cycle repeats ad nauseum. Story 30. My mother has been an ER nurse for more than 25 years. She once had to take care of a mob boss from Chicago that had a heart attack after beating his 6 months pregnant wife to death. Story 31. I won't accept a patient until I do a meet and greet. If they're already on narcotics, are rude, demanding, or have a complicated psychiatric history, I tell them that I'm probably not the best physician for them. It saves them a lot of trouble later, by the way, as long as it's not an emergency. Physicians can refuse to see a patient at any time. It's unethical, but not illegal. Story 32. Yes, although I really dislike caring for a man who hunted and killed mountain lions for sport and money. He used dogs with radio collars and baited traps. Not much sport in shooting a mountain lion who has gone up a tree to escape the dogs, or who has his leg broken in a trap and can't get away. Still turns my stomach when I think about it. Of course, there are a lot of evil people out there, some we know about, and some we don't. I definitely would not care for Cheney if he showed up at my office. My friend's crazy wife was refused treatment by several medical DRS. She has borderline personality disorder, and maybe because of this or not, she is very rude and bitchy. When they examined and questioned her, she didn't like or agree with what they had to say, so she would storm out of their offices yelling and swearing. He had to take her to several DRS until they found one who told her what she wanted to hear. Story 33. It's pretty normal to decline a ride in the ambulance when it's obvious it's not necessary. It's the doctor's decision. In my country, Czech Republic, people started to call an ambulance whenever something small occurred instead of going to the ER. Why? Because they would have to pay a fee of 90 crowns there. Yes, America. You pay literally thousands of dollars in care, and here people won't even pay $5 US. Czechs didn't even want to pay 30 CZK1 for a GP, so the parliament abolished it. Funny. Story 34. I wish. I'm a nurse in a hospital, so we can't refuse patients. We had one patient who was only there a couple of days, thank God. He threatened to sue us every day, Every single person who came in the room, he berated and called them incompetent. On day shift alone, he went through 2 different nurses who eventually refused to continue to take care of him after a few hours because he was so awful. My manager ended up being his nurse and basically never left the room. She cleaned the room with the housekeeper and was in the room when he ordered his food and when the doctors visited him. He still called the dietary people idiots for bringing him the wrong food. It was exactly what he ordered, threatened to sue the doctors for negligence, etc. At one point, he was complaining that the hospital wasn't doing enough and the nurses weren't doing enough for him. My manager said she had been in the room all day, and she said that they've been doing absolutely everything they could be doing. He said that it wasn't enough, and they should be working harder to please him. He also constantly talked about how other hospitals in the area were way better, and our hospital was a hole that only hired stupid. He was mean and derogatory, and I wish we could have just shipped him off to another one of the better hospitals. Story 35. My father is a doctor, a rheumatologist. He basically sees elderly people, but this one, she was insistent that she needed pain medication for her arthritis. Cute blonde in her 30s. Her hands wouldn't open. She had crazy back spasms. She would click her words. My dad decided she was faking it and refused to give her anything. Mind you, he's also an ERR. She died, raving, crazy mad, throwing jello at gators in the bathroom. 3 days later, she wasn't hooked on any drugs. He misdiagnosed her. She flayed and danced on his table in a seizure, and he couldn't fix her, broke her neck. She ended up having a brain tumor, and that was what caused the seizure and hallucinations. Her sister came in a few minutes later, thinking she was visiting a patient with life. She tried to kill my father with a syringe, swung it, got his neck, but didn't puncture. He laid her flat, aka knocked her out with a fabulous jaw punch, and called the police on staff. Edited, they took the sister to a mental facility, and my dad was assigned to her. He refused. Story 36. When I was a resident, we had a patient in the hospital who had bona fide Munchausen syndrome. One of the residents caught her rubbing feces on her foreport, so she'd get sepsis. She would be admitted every 2 to 3 weeks for a few days with some infection or vague abdominal complaint and monopolize our time and resources, demanding staggering doses of opiates and $1 million worth of labs and imaging. We actually had meetings with our attending physicians to see if there was a way to legally refuse to admit her anymore. But we always did. When I was the on-call resident, I would spend more time taking care of her complaints than all of the other inpatients on the floor combined. Story 37. Not a doctor, but a paramedic had a patient in police custody for solicitation in my ambulance about a transport. The patient kindly took her hand, rubbed it all through her vaginal area in her pants, and held up her dripping hand to me and said, "Don't touch me." She then took a swipe and hit me knee. I told the cop have fun and got in the front with my partner and peeled out of there. TLDR point, rubbed vaginal juices on me. I let the cop hang out with her in the back. Story 38. As an ER doctor, we're not allowed, and I like to give everyone the benefit of the doubt. When you're sick and pain vomiting, it can wear on the nerves as badly as anything, but I won't hesitate to have security you out if you ever threaten any one of our staff. Story 39. I'm a paramedic. I can't say this enough. The ER and calling 911 for an ambulance is for an emergency. Your chronic pain is not a 911 matter or an ER matter. You need to see a specialist or get a referral to a pain clinic. There's a difference between chronic back pain or gout or sickle cell crisis or other chronic pain and acute pain that comes out of nowhere. Chest pain, abdominal pain, new onset back pain. Those are potential emergencies. If you call 911 for your chronic pain, don't expect me to crack my box for you. And most ER doctors won't help you either. The ER doctors have access to a system which tracks all the prescriptions you've gotten, and they will know if you're a drug seeker or too lazy to see your specialist versus a legitimate new onset pain patient. Story 40. We have all had patients that are drug seekers and lie or are adamant about antibiotics for the common cold. But as their provider, I can refuse to give them a prescription while still being their doctor. The only time a patient has been refused from care is if they personally threaten the staff I work with. Story 41. Just curious. How is weed in chronic pain? I've often wondered if it actually is a competent replacement for pharmaceuticals or just an excuse to integrate weed into society to make money alcohol. Story 42. Really, I would just duplicate the quiet room. No one has been able to stay in a room for more than 45 minutes. Even if they rip all the off the wall, it still would be so quiet the person would run out of the room, screaming. Story 43. I get them pre-hospital all the time too. Same people, over and over again. I have severe back pain. They gave me fentanyl. Yeah, do you have that? Either that or the I need pain meds, but tramadol, ibuprofen, or any of those work. I need Dilaudid, fentanyl, or morphine. And last but not least, you need to take me to XYZ hospital, but ABC hospital is closer. I hate ABC, and I can't go there. It is funny. They know the docs know them and won't deal with their doc shopping at its finest. They get mad. I don't give them anything. Game over. I hate to bring it to the ED, but I think it will be frowned upon if I brought them to a McDonald's. And I should clarify this since a few of the messages I've gotten are really off the deep end. If someone is truly in pain and needs pain management, they get it. I don't withhold medications because at one point in time try to get pain meds. There's a huge difference between someone who is in pain and someone who is seeking meds. If you want to yell, swear, and get angry at me about this post, you're judging entirely on a post about drug-seeking behavior. They'll gladly talk about anything else too. Story 44, can't forget the drug seekers on disability whose blood work shows that they're not even taking the OxyContin you prescribed them. My dad's an orthopedist. Story 45, my sister was friends with a girl whose father would intentionally hurt himself so he could have time off of whatever work he had. And so, the clinic we called at the Band-Aid station would supply him with pain pills. Yeah, we separated ourselves from this guy and his family after he managed to break his hand at 3 a.m. and had to call my dad to take him to the hospital. My dad managed to coax an honest answer out of the guy, and he said he smashed his hand with a hammer. He told the doctors at the ER he slammed his hand in the car door. Story 46, I have legitimate back pain. I also have very low blood pressure that can be barely above normal when I am in excruciating pain. When I'm in so much pain that I can't sit on the toilet and have to stand in the shower to pee, I can't wait 2 weeks to see my PCP. It is so very demoralizing to be treated like a drug seeker when I am in pain. What can I do to convince an ER doctor that I am for real? I hate pain pills. I have no interest in taking them recreationally. I just want to quit hurting. Story 47, which ruins going to the doctor for people like me. I'm 19. My doctor never takes me seriously. I upped my shoulder a few years ago playing hockey, and the doctor won't give me 20 minutes of his time to diagnose the problem. I don't even want pills. I hate pills. I just want to know what's wrong. Thanks, pillheads. Story 48, I agree completely. In 20-odd years of practice, the only people I can recall who made me want to refuse them, who also made me not like being a doctor, were the ones addicted to narcotics. When I have one on my schedule, I cringe and worry all day until they leave the office. My big tip-off with a new patient is when they compliment me on being a good doctor at the first visit, within the first few minutes of the visit. They almost always request narcotics before the end of the visit and get very angry when I decline to prescribe or when I point out their history of getting large amounts from multiple doctors after I check their controlled substance monitoring program report. I love my job, but I hate this part of it. I have come to the point where I always run a report before I see a new patient. Wish I could never see another addict. The drugs make them terrible. Story 49, to try and have empathy for these people. I think to myself that happy people just don't get up one day and say, I need some drugs, something bad is going on in this person's life. Doesn't excuse their behavior, but can make it less likely to ruin your day. Story 50, best quote I ever heard from a seeker: I'm allergic to 2 milligrams of Dilaudid, but not to 4 milligrams of Dilaudid. People, man, I swear, as a former drug seeker who would go to all sorts of doctors, ER, urgent care, several diff PCP, I never even thought to get angry. It was always obvious to me, no matter how sick I was from withdrawal, that being angry would lead me nowhere. I always found having a good story, seeming innocent and genuine, not asking for the really good, and most importantly being super nice, worked wonderfully. I was only ever denied, actually caught, because the doc looked up my prescription history once, and I did it for over 2 years steady. Story 51, just out of curiosity, do you ever worry about being attacked by those people? An enclosed room with a crackhead who wants drugs is not a room I want to be in. Story 52, my dad gets this at his office all the time. Yet another of the many reasons to make every drug freely and legally available to anyone that wants it. I have no problem with anyone that wants to get high on opiates or anything else all day, every day. I do have a problem with doctors' time being wasted. Story 53, drug seekers are really annoying and make the rest of us look bad. Sometimes my Crohn's flares up really, really bad, and I end up in the ER in immense pain, usually a huge blockage. It takes a few days for the pain to get there, so sometimes I might get a tramadol or Neurontin from family members to help curb the pain and hope ITLL ease up and everything will be cool. But if it doesn't and I end up in the ER, I let the docs know I took X pill, I don't have a prescription, it was given to me to help out. Though my dad gave me a Percocet once, and now it's forever on my prescription list. And I explain every time that no, I'm not on Percocet. My GI just refuses to give me anything for pain. Anyway, my point is I get all nervous and uncomfortable telling them I'm in pain. So I usually explain the entirety of my Crohn's before I even get to the pain aspect, in hopes they don't think I'm some junkie. Story 54. This is my mother through and through. She's convinced she has some sort of medical problem that no doctor has been able to figure out. It's drugs. She actually finally secured a referral to a huge hospital in Denver just to waste their time. I apologize on her behalf, but try to realize these people have serious mental issues. It's just as frustrating for me.